During the COVID-19 public health emergency, which is still in effect, states received significant increased federal funding to provide continuous Medicaid coverage. In exchange for the increased federal funding, states could not terminate beneficiaries since March 2020, even those who are no longer technically eligible for Medicaid. After the continuous Medicaid coverage provision ends, states will return to normal operations and eligibility determinations. This is referred to as the PHE unwinding. At that time, Floridians will begin receiving notices from the Department of Children and Families that they need to renew their Medicaid eligibility. And many will ultimately receive notices terminating their Medicaid eligibility. This video and the portal resource materials have been created as a basic training tool for legal services staff, navigators, healthcare providers, and others who assist Florida Medicaid recipients. Additional helpful information can be found on the Florida Health Justice Project's website and in this longer overview video, which provides more detailed information on the background and status of the PHE and the ongoing coverage requirement, a review of Florida's Medicaid program, including who is eligible and how to determine the income eligibility for different family members, and an explanation of why Florida's parents and caregivers are among those most likely to lose Medicaid after the continuous coverage requirement ends. This video will explain why 19 and 20-year-olds, along with parents and caregivers, are among those most at risk of losing coverage. And it explains the circumstances in which 19 and 20-year-olds, unlike their parents or caregivers, might be able to maintain their Medicaid coverage. To help you get the most out of this presentation, we divided the video into topics and provided timestamps so you can easily go to the desired content. In addition, we have included important resource materials in the portal located directly below the video. Before we turn to the basic considerations for 19 and 20-year-olds and their families, it would be helpful to do a basic overview of Medicaid income limits for different family members. This chart from DCF shows those limits for each family member, including adults, pregnant women, infants under age 1, children age 1 through 5, and children age 6 through 18. The chart, which is an essential resource, can be found in the portal, and our overview video carefully explains how to use it for each of the different coverage groups. As you can see, Medicaid income limits gradually decrease as the child gets older. The Household Federal Poverty, or FPL, for age groups goes from 211% of poverty for infants under age 1 to 145% for children 1 to 5 to 138% for children 6 to 18. And then when the child turns 19, the income eligibility plummets to only about 30% of the federal poverty level. This is the same meager income limit that applies for parents and caregivers. Let's walk through a hypothetical situation in which your nonprofit is helping people understand if they will be eligible for Medicaid after the PHE unwind begins and what they need to do to prepare. And because there are special considerations for 19 and 20-year-olds who may be able to stay on Medicaid even when their parents are ineligible, you're providing critical, targeted outreach and assistance to that population. You are now scheduled to interview Sonia, a mother who lives with her daughter, Olivia, who is now 19. Both mom and daughter have been on Medicaid since April 2020, when Sonia lost her job early in the pandemic shutdown. Sonia is now working and earning $1,000 a month, and Olivia is working part-time and earning $300 a month. Before today's meeting, you have already discussed with Sonia that she will lose Medicaid after the PHE ends because Olivia is no longer a minor child. You provided her with material that can be found in the portal and which explains that Florida parents and caregivers must have a child under age 18 in order to be eligible for Medicaid, no matter how low their income may be. And today, though, your focus is on Olivia. Under DCF rules, 19 and 20-year-olds can receive Medicaid as part of their parents' household or as their own household in certain circumstances. So you want to figure out what the relevant income limit would be for Olivia, either as a household of 2 or as a household of 1. You can do that before your meeting with them by looking at the family income chart. Beginning in the far left column, you look at the income limit for a family of 2. Moving to the right, you see the column labeled parents, caregivers, children 19 and 20. And the number there is 241. Continuing to move to the right on the chart, you see a column titled Standard Disregard. And the number there is 146. And moving to the far right, the last column is titled Magi Disregard. And the number for a family of 2 is 76. After you add up those numbers, you know that if the family income is more than $463 a month, Olivia will no longer be eligible for Medicaid. And so in this hypothetical, Olivia would be way over income for the 19 and 20-year-old coverage group in a household of 2, where you're counting her mother's income. Next, you look at the income limit for a household of 1, where you only consider Olivia's income. Again, starting in the far left column, you know that the family size is now 1. Moving to the right, you see the column labeled parents, caregivers, children 19 and 20, and the number there is 180. Continuing to move to the right on the chart, you see a column titled Standard Disregard, and the number there is 109. And moving to the far right, the last column titled Magi Disregard, where the number for a family of 1 is 57. Thus, if Olivia files her Medicaid application for a household of 1, she does not count her mother's income, and her income of $300 a month is below the eligibility cutoff. So now you are ready to meet with Sonia and Olivia and discuss the rules and considerations for 19 and 20-year-olds applying for Medicaid as a household of 1. One consideration is taxes. Importantly, if Olivia files as a single household for Medicaid, Sonia cannot claim her as a dependent on Sonia's taxes. The next set of considerations look at whether Olivia still lives at home. Under Medicaid rules, she can live at home with her mother if she files her own tax return, or if she does not file a tax return, she can still live at home and apply for Medicaid on her own and not count her mother's income if she is not a full-time student. Assuming Olivia is eligible to apply for Medicaid on her own, another major consideration is if she has health conditions, which make it important that she stay on her health coverage and not risk any interruption in her insurance. Another consideration is if the family would be eligible for subsidized insurance in the federally funded marketplace. And there is information in the portal on free navigator resources in Florida. Under this hypothetical, because the family income is less than the federal poverty level, They are not eligible for subsidized insurance in the marketplace, and they are in what is called the coverage gap. There is more material about the coverage gap in the portal materials and the overview video, but to quickly recap, the coverage gap exists in Florida and the 10 other states that have not expanded Medicaid under the 2010 Affordable Care Act, which had provided two paths to coverage for people with low to moderate incomes. First, people with moderate incomes, 100 to 400% of the federal poverty level, would receive subsidies to help pay for insurance in the new healthcare marketplace. Second, low-income adults under age 65 would get healthcare coverage through expanded state Medicaid programs. However, in 2012, the Supreme Court ruled that the ACA's requirement that states expand their Medicaid program to cover low-income adults would instead be left up to the individual states. And because our state has not expanded Medicaid, low-income adults who have been receiving Medicaid health coverage throughout the PHE, but who are no longer eligible for Medicaid in Florida, will also be ineligible for an ACA subsidy if their income is below 100% of the poverty level. But again, there is a coverage option for Olivia as a 19-year-old if she applies for Medicaid as a household of one. After the PHE ends, Olivia should let DCF know that she wants to apply as a single household. She should do this by going on Access and opening her own case. As you can see, there has been a tremendous increase in the number of 19 and 20-year-olds enrolled in Medicaid since the PHE's continuous coverage requirement began in March 2020. Before the pandemic, less than 63,000 19 and 20-year-olds had Medicaid. As of October 2022, that number has more than tripled to over 200,000. After the PHE ends, Medicaid coverage for many of these youth will also likely end unless they apply as a household of one. 19 and 20-year-old individuals on Medicaid who want to review their eligibility should contact the Florida Health Justice Project.